हेलो गुड मॉर्निंग, मैं से डॉक्टर आर्यन और आज हम डिस्कस करेंगे मेडिसिन के कार्डियोलॉजी सेक्शन के सम इंपॉर्टेंट MCQ। A 60-year-old female with poorly controlled hypertension present to the emergency department with severe headache, blurred vision, shortness of breath, blood pressure, and examination reveals papillary edema. What is the most appropriate initial management for this patient? Administer sublingual nitroglycerin, benign oral antihypertensive medication as output management. This is wrong answer. And admit the patient to the ICU with start intravenous labetalol is the right, because in the scenario the patient present with severe symptoms including headache, blood vision, and shortness of breath, along with a significantly elevated blood pressure of 210 by 140 mmHg. The presence of papillary edema indicate end organ damage. Indicate end organ damage and suggest the presence of the hypertensive emergency. The hypertensive emergency. The most appropriate initial management strategy to the admit the patient to the ICU and start intravenous labetalol. Intravenous labetalol are anti-hypertensive medication for patient with the hypertensive encephalopathy, such as patient the referred parental anti-hypertensive drugs are nitroprusside, nicardipine, and labetalol. Nicardipine, nitroprusside. The management in the malignant hypertension medication gives labetalol, nitroprusside, enalapril, and in stroke nicardipine, labetalol, nitroprusside. In myocardial infarction, nitroglycerin, nicardipine, esmolol. In acute LV failure, enalapril, loop diuretics. In aortic dissection, nitroprusside, esmolol, labetalol. Adrenergic crisis, nitroprusside. Next question. Review the statement about the control of blood pressure and identify the incorrect one. Physical activity like brisk walking for 30 minutes a day will reduce systolic blood pressure by approx 10 to 20 mmHg. This one is the wrong. And tracking of blood pressure implies that if a person is hypertensive in childhood, then the person remain hypertensive in adulthood. Correct. The rule of halves in hypertension, where the only 50% of people who are aware of their hypertension receive treatment. Correct. Dash stand for that approach to stop a hypertension. Right. Here the question are the incorrect one. This one is the incorrect one. Here the answer. Physical activity like brisk walking for 30 minutes a day reduce systolic BP by approximately 4 to 9 mmHg and not by 10 to 20 mmHg as given the statement. What is the modification recommendation? Modification recommendation and approx systolic BP reduction in weight reduction 5 to 20 mm Hg per 10 kg weight loss in adopt the dash eating plan 8 to 40 dietary sodium reduction sodium reduction 2 to 8 mm Hg and physical activity 4 to 9 mm Hg. Next question. A 58-year-old male present to the clinic for a routine follow-up. He has a history of hypertension and type 2 diabetes mellitus for the past 10 years. His blood pressure is currently 150/90 and his fasting blood glucose 160 mg. On further examination, his serum creatinine is 1.5. With an estimate eGFR of 45 ml per minute 1.70 meter square, which of the following is the most appropriate target BP for this patient? The patient has a history of both hypertension and diabetic nephropathy indicated by the elevated serum creatinine level and reduced GFR. The correct answer is B. The recommended target BP for patient with hypertension and diabetic nephropathy is less than 130/80 mmHg according to guidelines. The organization such as the American Diabetes Association ADA and the American Heart Association AHA and AHA. This lower target helps to reduce the risk of further renal damage and cardiovascular events in patients and these comorbidities. Target blood pressure, target BP, a goal to be maintained in patient with STN is target BP, or goal to maintain patient with hypertension, the 135, 140, 85 to 90 mmHg. Target STN along with diabetic nephropathy, this is 130/80 mmHg. Malignant hypertension mean arterial pressure should be reduced by 20 to 25. Arterial pressure reduce 20 to 25%. Exceeding this value leads to the compromised coronary circulation and a renal ischemia over the 2 hours. This is the main point. Important. Next question. A 45-year-old male with a known history of pheochromocytoma present for surgery. Pre-operatively, he was administered phenoxybenzone during the operation. The BP spiked to 200/120 mmHg. Which of the following medications should be administered intravenous to manage the hypertensive crisis? Propranolol, hydrochlorothiazide, nitroprusside and metoprolol. The correct answer is nitroprusside. Because the pheochromocytoma is associated with the risk of adrenergic crisis, during surgery due to excessive release of catecholamines. Preoperative preparation typically include alpha-adrenergic blockade with medication like phenoxybenzaimine. And during intraoperative management, if a hypertensive crisis occurs, rapid-acting vasodilator are essential. And propranolol is a non-selective beta blocker. Selective beta blocker, and it is not recommended managing hypertensive crisis associated with pheochromocytoma due to risk of an unstopped alpha-adrenergic activity which can worsen hypertension. And hydrochlorothiazide is a thiazide diuretics and are not indicated for the management of hypertensive crisis associated with pheochromocytoma. And the metoprolol is a beta blocker and is controlled in the management of hypertensive crisis in pheochromocytoma due to the risk of unopposed alpha-adrenergic activity.